All right, we are live. Good evening, everybody. Christy here at the National EMS Museum. I'm here with some of my team tonight. It's always exciting to get a volunteer in the hot seat. Our coffee with Doc is on, and we have museum volunteer, educator, uh, law student for fun, not practicing lawyer, Rick Narad, and we are certainly excited to hear about his journey through EMS, which is not the traditional one you're probably thinking of. So I will turn it over to Doc and grab your afternoon, evening beverages and join us.
Good evening, everyone. Hey, Rick. Good to see you
Yeah.
again. Nice to have you back in the fold temporarily. For those that don't know, Rick was involved with the EMS Museum for a number of years and then trundled on off to California and is busy working instead in the education field. So let me go back sort of kind of in the beginning. Where did you get your initial EMS training, Rick?
Well, initially, I was a volunteer firefighter, and then I became a paid firefighter. And I wanted to get EMT. It was a fairly new thing at that point. And so three of us from Santa Rosa Fire Department went and took the class. And it was early enough that the fire department didn't really know what it was. They told us, no, you can't wear an EMT patch. That doesn't have anything to do with being a firefighter. So later on, they finally figured it out that it was. But so my original EMT came from Santa Rosa Junior College in 1975.
Very cool. My God, I too started out as a volunteer firefighter and then was paid, and then later on got into EMS because where I worked as a firefighter, our way of managing people in those days at a wreck was wait for the 57 police wagon to show up with the Stokes basket in the back, put the people in the back of the wagon, and get them out of here to the hospital.
I remember those days.
Very advanced.
So I was working there at the fire department and said, this paramedic thing really sounds interesting. And it was just, again, very early days. And I decided I wanted to be in on that ground floor. So I decided I was going to go to paramedic school. And 3 o'clock in the morning, before going to paramedic school, 3 o'clock in the morning, I woke up and said, this is really fun now, but I'm not going to want to do this the rest of my life.
Yeah.
So then I spent a year trying to figure out what I wanted to do, and ended up looking at health services administration, and realized I could be an EMS administrator, and that's the direction I went. So I got out of the field. I was in the field a total of 7 years, and then moved into administration and did that for a lot of years.
Yeah, boots and bunker gear at 3 o'clock in the morning don't look too great, do they?
They don't. And, when you're 24, 22, whatever, yeah, you can get up in the middle of the night a bunch of times. Doesn't matter. But look into the future. I said, I'm not going to like this in the future. So I decided to get out before I burned out.
Yeah. So from Santa Rosa out on the West Coast, you ended up back in Massachusetts with Merrimack Mass EMS.
I did. I finished my undergraduate at California State Chico, where I'm teaching now. And I wanted to work in EMS administration, and I really didn't care where I did it. So I was applying all over the country. And the first people who offered me a job were in northeastern Massachusetts. So I packed up and I moved there. And it was a brand new organization. And that's been most of my career has been new organizations. So I got to work with them. They had a 1-year planning grant. And the day I showed up, they didn't even have an office. They didn't have a phone. They didn't have anything. So I got to build it from scratch. And I was there for about 19 months. And then the job opened up in California. So I came back to the part of the country I think I'm going to stay in the rest of my life, and was fortunate to come back to Santa Rosa, where I worked, but now as director of the county EMS agency.
So you then went to Santa Rosa. You ended up at Sonoma County. You were there for 5 years in an administrative role in EMS.
Mm-hmm.
And then you got off the street, essentially.
Well, I got off the street before I went back to college, or while I was in college. So I got off the paid the paid path in 1977, continued as a volunteer for 2 years while I finished college, and then moved completely out of the field into the administrative area.
Okay, so
That
now,
was 1979.
all right, California, that's CSU or California State University, Chico.
Yes.
What was your original position when you and I first got acquainted? What were you doing at that time?
At that time, I was doing what I'm doing now. I was a professor of health services administration and director of the undergraduate program in health admin.
Okay, so you've been in a senior position in the educational program there for a hell of a long time. How
A
long?
long time. I came back to Chico on faculty in 1989 and tenure track 1990, and I'm still here. So count the years. It's been a long time.
Must be doing something right.
Or not, but yeah, so it's been a lot of years, but I love Chico. I love teaching, and so decide this is the place to stay.
Okay, you and I have been involved in the education of kids in our profession for a long time. What do you see as how the folks entering the profession have changed over the years?
Interesting question. Of course, now I'm dealing with people who want to be administrators. I do get some people who, plan to get their degree and then go, fire service or EMS or some other area, but mostly they're heading towards administrative roles. But of the people who I see going into the field, I think one of the big differences is that they're seeing paramedic as their entry point, where when I was doing it, paramedic was something way above. We all started first aid, we started EMT, and that's where we learned how to function, and then could go to paramedic school and learn the clinical side more.
Yep.
But now that's being seen more as entry level. It's also being seen as more of a direct path to the fire service, and people are seeing that as a direction, not the medical side, which I find sad.
Yeah, and it's I see more and more fire EMS and less presence of third services in charge of EMS for an area.
It's certainly different around the country, different areas, but I still remember a fire department where the ambulance was the punishment detail. So if you messed up at a fire, they would put you on ambulance for a month.
Yeah.
And that's certainly not a good way to promote professionalism. It's not a good way to promote good quality care. And I have a fear that we're going back in some ways to that era.
Yeah. So it's interesting, and you look at third services, and I happen to be in a discussion with some guys in Germany and Austria today, and we were talking about GMR, and I looked up their numbers as to the number of ambulances that they own, the number of air assets that they own. So they are still huge by comparison. So you asked me to ask you this earlier, and I think I will. What was your first ambulance run? Let's talk about that.
So my first ambulance run was 1972. And yes, I realized that I've just aged myself a little bit, but I'd say I was 18 at the time. So I was a volunteer firefighter. I'd started as a volunteer in high school in a small town, and the police department actually ran the ambulance, but they parked it at the firehouse. And sometimes when the police were busy, they would call over and say, "Hey, is there anyone there who can go with us on this call?" So I was there one day, they got a call, and I said, "Yeah, sure, I'll try that. Why not?" So we go out on this call. I was 18. I had zero medical training of any kind. I had no first aid. CPR was just a new thing at that point. Our ambulance was state of the art because we had a radio you could call the hospital with. It was an old Cadillac Miller Meteor ambulance, which I'd love to own today. But they would send people out on calls without training. Training was not seen as anything needed. It was the ability to lift the gurney, and that was all that was needed. Yeah. And to me, looking back at that, and then very quickly in the next few years, as the training started becoming standardized and then started becoming required, I think we had a major change in EMS at that point. And I was kind of lucky enough to have been right there at that time to see what it had been before we started becoming professional.
Yeah, yeah, yeah. I started doing this stuff in '57,
Oh, okay.
and you know, if you had a Red Cross first aid, advanced first aid course, you were really well trained in those days,
Oh, yeah.
which was pretty stunning. Um, so, what is the career path for since you're molding people who are going to go into administration in EMS? What is the optimal career path for these folks in terms of becoming effective EMS managers and EMS administrators?
Well, I think part of it is based on EMS is part of a larger thing. One way or another, EMS is part of something larger. I view EMS as a healthcare function. I think we're taking care of sick people, and it really doesn't matter what color your vehicle is or what color your uniform is. We're taking care of sick people. So I want people to understand EMS as part of the healthcare delivery system. So my degree is health services administration. I have people go into hospitals, they go into skilled nursing, they go into public health, all sorts of areas, and some do go into EMS organizations. I've seen people go into it in several ways. Certainly, some people have gone in through a clinical side. I have one graduate who went in as an educator. She was working the field, and then she started running the organization's CPR training program. Another one was the compliance officer for the organization. So she came in with a bachelor's in health admin and worked with the organization to make sure it was not going to get in trouble with Medicare. So that obviously took a lot of training in the rules and regulations. There's really not a single direction that people can go. And I think when you look at the sophistication of the larger ambulance services, you see the parallels to hospitals. So you need a logistics arm that we didn't used to have, just like hospitals have materials management. You need all of the business operations. You don't just have one billing clerk, you've got a whole bunch of them there, just like a hospital would. So from that, you start needing the higher level administrators too. You need a financial analyst, you need HR people, you need all of the administrative functions. And that's where I see people getting their foot in the door and moving up on that side. Being a paramedic or being an EMT doesn't train you how to do financial analysis. You got to learn that separate. Now, it's kind of nice if you understand the language of it, but most administrators are not clinical people in EMS or anywhere else. And I think when we promote people who are really good in the field without giving them proper training, we're setting them up for failure.
Good point. How do we, you know, I'm part of a critical incident stress management team, and all we deal with is first responders.
Yeah.
What do you think about employee assistance programs versus outside CISM people coming in when there's been a problem?
I think you need both. I think the problem is a different thing you have to deal with, a different creature than just the day-to-day things people deal with, which may be work-related or may be personal. But I think there's room for employee assistance, and there's also a room for saying, we just had a large incident. We need to talk about this with people who are trained to do that.
Yeah, my one observation is that if I come in on a diffusing situation, and I've done some nasty ones, they don't know me. I don't know them. I get them to open up. I hear what they need to hear, and then I pass that information along to those in administration that need to follow up with certain individuals in the group. And I think my perspective, at least, and I may be wrong, and I'd like to hear what you think, is that where they might be reticent to open up to their peers, they're not at all reticent to open up to me because they know I'm going home and I'm not taking notes. What do you think?
I think they know you're not going to use it against them. And we still have that fear that it's okay to say I broke my arm, but it's not okay to say I saw something really terrible and I can't deal with it. Okay, we don't we don't let people say that. And that's what we need to do. So there does have to be a trust issue. And I agree with you, an outside person, whether it's through critical incident stress team or whether it's through an employee assistance program, either way, it's got to be someone who is not in the normal chain of command and someone who knows what confidentiality is and tells everyone what confidentiality is.
Yeah.
Um, I did a 3-month deployment this year with CalMat, which is our state's version of the DMAT teams. And I was at an alternative care center. And our mission was half civilian, half military. So one of the benefits of having the military there was they brought the behavioral health officers who we did not have. And it was really obvious very quickly how much value they added. You know, having people who could just do private office hours, right? Or wandered around and saw how people were dealing with things when you're dealing with, 12-hour shifts and no days off, for a long period of time. It was really important. And that really convinced me, if I didn't believe it before, I sure know it now, the value of having behavioral health people accessible for us.
Are from your graduates, the folks that you have educated, and I'm sure you stay in touch with a lot of them.
Well,
Are we keeping the good people in EMS, or are we losing them still?
I think it varies. It's hard to say. When people go into EMS with the goal of becoming a firefighter, and they go into the fire service with the goal of putting water on the red stuff, they're not committed to EMS. So the question is, how do we get people who go into it being committed to being EMS people and providing good patient care, not seeing it as a mechanism to get to their later goal? And that's not a new problem. We've had that problem from the very beginning, but I just don't see it changing, even though fire service is doing an incredibly high percentage of their calls as medical calls. There's still an attitude in many departments, and I don't want to say all departments, definitely not all, but there's an attitude in a lot of departments of that's beneath us. That's not what we really do. So we hate those calls because we're waiting for the good ones, the ones we're really supposed to do. And that means that attitudinally people are leaving, and they're physically leaving if they can to get away from the medical side that enabled them to get to where they were.
And is it not money driven in a lot of places?
Do you think? Of course, yeah, absolutely it is. It absolutely is. And, I look at a certain large city, about 2 hours south of me, and I'm not going to mention Sacramento by name, but they have a very expensive ambulance program through the fire service. And I'm thinking, okay, well, why do they need that? Why can't they contract that part out? People are going to be paid less. They're not going to have the heavy retirement. Maybe they should. I mean, I don't want to say that people don't deserve it, maybe, but on the other hand, there's a very large expense to the public that I think doesn't get considered when you're not offered that choice of which direction really is the right direction. And that, by the way, is my research area, is how do communities make decisions about what their system should be?
Yeah.
And the answer is usually they don't. It's usually
Well,
incremental.
I'm not sure that a lot of communities make the decision. I think they just sort of end up in the position sometimes.
Yeah, it's incremental change based on tradition.
Yeah.
And the only time you get a big change is when you have a crisis.
Yeah. Yeah. It's interesting. Years ago when I was teaching down in South Florida, when I came back to the States, we had kids that thought they were always going to stay in Dade County or Broward County. And I said, no, if you're going to move vertically in this profession, you need to think about moving. Always think about moving and looking for the other opportunity.
Yep.
And that's tough for young
people. It is tough, but that is great advice to give people, particularly if you want to fast track. If you want to move up fast, you have a choice. You can either go to where the job is, or you can wait for the person in front of you to die. And, if you want the fast track, go to where the job is.
Yeah. Where do you see EMS becoming more fire-based in the future, or do you think that some of the larger third services will survive, or what do you think?
I I think it's going to be really different around the country. I think it's real hard to predict things like that because what happens in one area is different than other areas. And you see that with hospitals too. Who owns hospitals varies around the country. So certainly the fire service is pushing for it. Certainly they see that their own success on fire prevention means that there's not a lot of fires the way there used to be. So they need to do something to justify the existence. But uh, but I think at some point communities are going to have to start pushing back as well. So in California, several communities have a crisis because of retirement system costs, and public safety people who can retire at age 50 now uh, are very expensive. And we've had a couple of cities declare bankruptcy mainly because of their retirement costs.
Yeah,
I think that in itself has to get people to start asking the question.
yeah,
The power of the fire department unions, the general respect that people have for firefighters, uh, makes it a hard argument for some communities to say we need to look at another alternative.
yeah,
But on the other hand, I think we're going to have to.
yeah. So we've been through this pandemic thing now for about a year. What have you seen professionally that the impact, what has the impact of the pandemic been on our profession over the last 12 months?
We've been real busy. I mean, that's kind of the bottom line, and that's really true everywhere. I think that uh, healthcare facilities certainly saw it earlier than pre-hospital, but pre-hospital then got jammed with it just in the same way. I read a essay the other day in the New York Times from someone who was an EMT in New York about the early days of New York's first surge. And it's like he went to more calls in a week than I would go to in a year usually. Of course, New York, they probably do that anyway,
Yeah,
that kind of volume. But I think that it it showed that we have to have systems in place to deal with surge. And I'm worried about when the adrenaline rush goes away. The president yesterday said he's aiming at we should go to July 4th parties this year, and I hope he's right. But when that surge ends of adrenaline, along with the surge of patients, I wonder if we're going to be dealing with a lot of emotional health issues, if we're going to be dealing with a lot of people who find out they were burned out. They were probably burned out 6 months ago, but the adrenaline kept them going. So I really wonder what's going to be the future in the next couple of years for healthcare professionals generally. And I think anything we say about EMS, we can also say about nurses as well. There's going to be a lot of people who just say, I cannot deal with this anymore. I can't go in and see one more patient.
sure.
So I hope organizations are dealing with it in a positive way, either to find a way to get people the support they need or to ease them out in a positive way so that it's not hurting either patients or the people, the individuals. But I have a lot of fears about what it's going to look like in the next year.
Yeah, I think there's been a tremendous additional emotional burden
Yeah.
placed on anybody that has primary contact with patients. Um, I have an emergency physician friend of mine.
Mhm.
Uh, he basically said, "I'm done." He said, "I'm done. I'm gonna do
Well,
something
and
else."
some of it is certainly just the pure volume of patients that some people have to deal with, the volume of deaths, but also the fear of the disease impacting me or impacting my family.
Yeah,
The combination of those three are all really serious. And I think if organizations think it's just going to go away and we're going to be like we were a year ago, they're deluding themselves. We are not going to be.
yeah. I'm just concerned about the kids' heads saying, "Okay, I've been exposing myself to this stuff for a year. I've dodged the bullet thus far. Is it worth it?" Um, And what's the incentive of staying in the profession? That's my big concern. And that would be not only our people in EMS, but nurses, which you mentioned,
Yep.
and some of the frontline docs.
Yep.
Um,
Yep.
it's tough. I've been doing a lot of inoculation pods and talking to a lot of these folks. They are freaking burned out, man. I mean,
Add respiratory therapists to that list as well.
yeah, yeah,
You know, ventilators are nice, but you need RTs to run them.
yep, yep. So where do we go from here, my friend? How do we grow the future crop of leading EMS administrators, EMS professionals, etc.?
Well, I think Christy wants me to make a plug for the museum, and I'm going to do that in a way to answer your question, which is that I think one of the things the museum does is celebrate EMS as a profession, as an entity, as a system, and I think that's what's going to help us grow in the future as well. If we're seen as part of something else, we're not going to ever be stable. But by having the EMS museum looking at all aspects of EMS, regardless of, as I said, regardless of the color of the uniform, I think that is going to help us grow in the future. It's one of the reasons I like working with the museum.
Yeah, point very well.
Christy's smiling. I must have said the right thing.
Yeah, no, I totally agree with you. And when people ask me what have I done professionally, I tell them I've been in public safety professionally. That way it covers the waterfront because I've done it all. I've been a firefighter, I've been a public safety officer, I've been a paramedic, been a flight medic, been a chamber medic, done the whole thing, but I've been involved in public safety. That's what I do. That's what we do.
Yeah.
And I think your point is real valid. Oh, you got a cat too, or a dog?
I do have a cat, and she's going to go away.
My cat has visited tonight.
Yeah, she likes to join meetings in my classes, and
my cat has remained in hiding the whole time. It's all right. But I think your point is well taken, that we need to preserve our history, our heritage, and that's really what the museum is all about.
And people need to see where they fit on the history, because otherwise the old line about if you don't know the history, you're going to repeat it. And we're going to have mass trousers again if people don't remember what happened with mass trousers, right? Or other similar things. That we need to know what's been done in the past. We need to know the fact that there's not one way, right? The fact that, where I live in my system is not the system, it's a system. I think the museum can show that by showing the variety of paths that led us to where we are today.
Yeah.
So yeah, I think it's a really critical thing to have this organization looking at our history.
Yeah, pneumatic anti-shock garment. There's an interesting part of our history, and I remember Norman used to get into these hellacious debates with people over pneumatic anti-shock garment and the value of them. His opponent in those debates is still alive, so I'll keep my lips shut. But it used to be something to observe. And one of the things that the two of those debaters did one time was, I forget what conference it was at, but they switched positions, and it was a riot.
Because they knew each other's arguments so well. They knew each other's arguments so well.
Oh yeah.
I had dinner one night with a group of people who had been in EMS before me even. One of whom was David Boyd, who at the time was the National EMS director, or director of the EMS program. And it was at one of the conferences, and I was lucky enough to sit there and watch the debate. And I'll always remember one of the comments that they were talking about how, just 10 years ago, the big argument was, should an EMT class be 76 hours or 94 hours or whatever the numbers were? Should the headroom in an ambulance be this number of inches or that number of inches? And when I was there with Boyd at the time, the big fight was, should we have trauma centers? Is it okay to bypass a hospital? So the comment that stuck with me is, we're fighting just as much, but we're fighting about much more important things than we used to fight about. And I think that's kind of been our history.
Yeah. For example, it was earth-shattering when it went to 110 hours. My God almighty, we can't keep people in a class for 110 hours. Yeah, you can. Yeah, you can. It's it's been fun to watch. I'll tell you that. It's really been something.
It is, and we shouldn't lose it. That's the important thing, that there's so many people who just don't know that EMT used to be 45 hours, and it was the top training that most people didn't bother with.
Yeah. Yeah. Cool. Thanks for the time, Rick.
It was my pleasure. I really enjoyed talking to you.
Yeah. See you
Thanks
later.
for having me.
Christy, do you have any words for our friends?
I just have one, maybe two really quick ones. We just got notification, so this is breaking news. Hall Ambulance has returned as a crew membership and is out to challenge other crews to join them in supporting the National EMS Museum. So in addition to individual memberships, last year we developed a crew membership. So if you're sitting here with your crew chief, or you are a crew chief, or you're a president of an organization and you want to get a membership for your whole crew, we offer that. You can check online, emsmuseum.org/support. It'll detail that membership. And that's it. We have a great lineup coming up March 25th and 26th. It's a little bit of a departure for us. Will be a Thursday and Friday evening. So stay tuned to social for all the details on our upcoming coffee sessions. And of course, if you're not a member yourself, please join us. Cool. And we're cooking up some cool things for this year. So stay tuned. Great. Thank you, Rick. Thank you, Doc. Really appreciate spending Friday night with y'all.
Take care, my friend.